A rigorous study published in the prestigious journal Diabetes Care revealed a fact that left many doctors amazed. Consuming a simple, cheap, and natural solution before meals can improve your body's efficiency in processing blood sugar by an incredible 34%. We are talking about something that acts very similarly to established medications, such as metformin and acarbose. But pay close attention. Before you run to the kitchen cabinet and take a spoonful of apple cider vinegar, I need to issue an emergency warning. Consuming this ingredient incorrectly hides 6 severe dangers to your health, ranging from severe burns in your esophagus to the irreversible destruction of your tooth enamel. Welcome to our channel, and in today's video, we're going to take a deep and definitive dive into the science. You'll understand exactly what happens inside your stomach and your pancreas when you consume apple cider vinegar. More importantly, I will give you the exact medically safe protocol to extract only the benefits without running any risks. If you are over 50 and want to protect your body against diabetes and premature aging, this video is tailor-made for you. Give this video a thumbs up. Subscribe to the channel so YouTube understands you value your health. And let's unravel this mystery together. To understand why apple cider vinegar isn't just another internet fad, we need to look at its main bioactive component, acetic acid. As we age, our body loses some of its ability to handle carbohydrates. You eat a piece of bread, a plate of rice, or a sweet, and your body quickly turns it all into glucose. That's where apple cider vinegar comes in as a protective shield. When ingested correctly before a meal, acetic acid acts on 2 fundamental fronts. First, it delays gastric emptying. This means food passes from your stomach to your intestines much more slowly and in a controlled manner. Second, science has discovered that acetic acid has the ability to inhibit the activity of enzymes called disaccharidases in the small intestine. These enzymes are like scissors that cut carbohydrates. If the scissors work slower, sugar absorption is suppressed. The practical result? That blood sugar roller coaster simply ceases to exist. Glucose enters your bloodstream in small doses, smoothly and gradually. But science goes even deeper. Vinegar is rich in antioxidant polyphenols, and during the digestion of fibers in our gut, the production of so-called short-chain fatty acids occurs, such as acetate, propionate, and butyrate. These fantastic acids bind to receptors in our gut and stimulate the production of wonderful hormones, like GLP-1 and PYY. These are the exact same hormones that increase your feeling of fullness and send a signal to your body saying, "We're satisfied, we don't need to eat anymore." And where does your pancreas fit into this wonderful story? The pancreas is the hero organ of our body, responsible for making insulin. Every time sugar spikes violently, the pancreas goes into overdrive and releases a flood of insulin to try and save your body. Over the years and decades, this repetitive effort leads to the exhaustion of pancreatic cells and the dreaded insulin resistance, which is the waiting room for type 2 diabetes. By smoothing the entry of sugar into the blood with the use of apple cider vinegar, you take a huge weight off your pancreas's shoulders. It can release insulin calmly without being overloaded. What's more, studies suggest that acetic acid activates metabolic pathways in our muscles, like the AMPK pathway, which helps vacuum glucose from the blood into muscle cells much more efficiently. This all sounds great in theory, but what do clinical trials with real humans show us? The truth is impressive. A recent and rigorous meta-analysis published in the respected scientific journal Frontiers in Nutrition in 2025 gathered 7 controlled clinical trials with over 460 patients. The researchers' conclusion was categorical. Apple cider vinegar consumption highly significantly reduced fasting, blood glucose, and glycated hemoglobin, HbA1c, in patients with type 2 diabetes. And they found that doses starting at 10 to 15 ml a day already begin to show excellent results. Another phenomenal study, SugarFit, monitored patients using continuous glucose sensors on their arms 24 hours a day. Type 2 diabetes patients who adopted apple cider vinegar before main meals managed to drop their glycated hemoglobin from a dangerous average of 8.3% to 7% in just 3 months. And as a positive side effect, they also had a reduction of nearly 7 pounds in body weight. It's science proving what popular wisdom already suspected. However, my friends, we need to be very responsible. As promised at the beginning of the video, apple cider vinegar is not water and has very serious contraindications if used irresponsibly. Grab your notebook because experts have listed 6 real dangers you need to know right now. Danger number 1, risk of hypoglycemia, and medication interactions. If you already use medications to lower glucose, like insulin or metformin, vinegar can potentiate the effect of these medications and cause your blood sugar to drop too much, causing dizziness and fainting. Furthermore, a study pointed out that in patients with type 1 diabetes who suffer from gastroparesis, extreme delayed stomach emptying, vinegar can worsen the condition and make glucose control more difficult. Danger number 2, esophageal burns. Vinegar is highly acidic. Taking it straight, like a shot, is an assault on your throat and your esophagus, potentially causing severe lesions and burns on sensitive tissues. Danger number 3, worsening of gastritis and ulcers. If you already have a history of acid reflux, heartburn, stomach pain complaints, or diagnosed ulcers, the acidity of the vinegar can act as a painful trigger, making your symptoms much worse. Danger number 4, tooth destruction. Dental erosion is real. Acetic acid in direct and frequent contact with your mouth irreversibly dissolves tooth enamel, causing pain, stains, and terrible sensitivity. Danger number 5, potassium loss, hypokalemia. Excessive and uncontrolled consumption over time can rob your body of potassium, especially if you already take diuretic medications. Potassium deficiency causes weakness, extreme fatigue, muscle cramps, and can even deregulate your heart rhythm. Danger number 6, unwanted interaction. Vinegar can also block or alter the effect of laxatives and certain continuous use medications. Therefore, the golden rule is always talk to your endocrinologist or dietitian before starting. Now that you know exactly how it works and what the dangers are, I'm going to give you the golden protocol to bulletproof your health and protect your pancreas with total safety. The right choice. Prefer organic, raw, and unfiltered apple cider vinegar. It contains that cloudy substance at the bottom of the bottle called the mother, which is incredibly rich in good bacteria and enzymes. The exact dose. Science shows we don't need to overdo it. The safe recommendation is 1 to 2 tablespoons a day, about 15 to 30 ml, divided among your main meals. The mandatory dilution. Never drink it straight. You must dilute this tablespoon of vinegar in a large glass of water, at least 8 ounces. The strategic timing. Drink the mixture 10 to 20 minutes before eating. This is the time your stomach needs to prepare to receive and break the absorption of carbohydrates from your lunch or dinner. Bulletproof tooth protection. Use a straw to drink so the liquid goes straight down your throat without washing over your teeth. Right after swallowing, rinse your mouth with plain water. And a crucial detail, do not brush your teeth immediately after drinking, as the acid temporarily softens the enamel and the brush can damage it. Wait at least half an hour. My dear friends, taking care of your health doesn't have to be expensive or complicated, but it requires knowledge and responsibility. Today we saw that apple cider vinegar is a powerful and scientifically validated tool to help your body tame glucose and give your pancreas a well-deserved rest. But remember, it is a supporting actor, an ally. It never replaces your medication, your healthy diet, and your doctor's guidance. If this long, detailed, and science-backed content helped you better understand your own body, I ask you to share this video right now. Send it in your family, friends, and church WhatsApp groups. There are a lot of people out there taking pure vinegar, destroying their stomachs and teeth due to a lack of correct information. Don't forget to subscribe to the channel and leave your like so we can continue bringing high-value videos to you. To continue your health journey, click on this video appearing on the screen where I talk about the best times to take your blood pressure medications. A warm hug, God bless you, and see you in the next video.